For decades, maybe you've heard the story, macular degeneration. Oh, that's just part of getting older, you know. Maybe you felt that way about your own health sometimes, just overwhelmed by info, or maybe feeling like there aren't many options. Well, today, we are going to challenge some of those ideas head on. Welcome to the deep dive. Today, we're plunging into macular degeneration. It's a huge topic, a leading cause of vision loss for so many. Our mission here is to uncover some really important, maybe overlooked information about how we can understand it better, maybe even intervene, especially focusing on dry macular degeneration. And we've got two amazing guides, Dr. Rozakis, he's an ophthalmologist, and Dr. Bakke, a biochemist. Their way of working together merges traditional eye care with, well, something quite different, functional medicine. It gives us really unique perspective.
It really does. Their combined expertise, it's led to insights that, frankly, challenge what a lot of people might see as standard care, particularly for that dry form, the one that often feels like just a slow downhill slide you can't stop. We're going to explore how their work suggests, well, a much more proactive path.
Yeah, it's a big shift in thinking, isn't it? For so long, it's just been, oh, you're getting older, this happens.
Yeah.
But these sources, Dr. Rozakis and Dr. Bakke, they strongly argue against that. They say very clearly there are real causes. It's not just about time passing. So what exactly are these root causes they've identified?
Well, that's the crucial question, right? Because if you can pinpoint these real causes, things like oxidative damage or inflammation, it just opens up totally new ways to intervene. They look at specific problems right down at the cellular level. Imagine oxidative damage, like rust building up on tiny, delicate parts in your eye, or chronic inflammation as this kind of low-level fire that's always smoldering in the tissues. They also examine issues with DNA repair. That's your body's own blueprint for fixing things, and even hormonal deficiencies. Those can throw off critical cell functions. Now, aging does play a role. Sure, it makes the cells in the macula a bit less protected, more vulnerable. But the key insight, the really hopeful part, is that this protective ability, it can actually be recovered, strengthened even. It's not necessarily a lost cause.
Wow, recover what you thought was lost. That's powerful. And here's where it gets really fascinating for me. Imagine a test, right? One that could flag you're heading for trouble before any visible damage even shows up. How does that work?
That's exactly what the ADAPTDX test is designed for. It measures something called dark adaptation. Basically, how long it takes your vision to bounce back after seeing a bright light. Think about walking into a dark movie theater from the bright sun, That initial blindness, then your eyes adjust. If that adjustment takes too long, it's an early warning sign for macular degeneration risk. Even before a standard eye exam shows any structural changes, it suggests the underlying cell machinery isn't quite working right, catching it that early before irreversible damage. That's what they mean by as close to a cure as possible, because you can intervene proactively, powerfully.
Okay, so proactive intervention, that really underscores the importance of prevention.
Absolutely. Prevention becomes a huge part of the solution here.
So if they can spot these issues before the damage is visible, how do they figure out the specific problems in one person versus another? It sounds much more detailed than a typical eye checkup.
And that's where their approach really is unique. They mention, quite pointedly, that they are the only group in the country that does blood testing for macular degeneration. And this isn't just like a basic screen, it's a deep dive into your specific biochemistry. They believe this is absolutely critical. These blood tests reveal your specific deficiencies, the precise underlying reasons why your body might be struggling in this area. This allows for a truly personalized treatment plan. Very comprehensive.
These test you initially.
Right, at baseline, then again at 3 months, and then every 6 months after that. It's this rigorous testing that lets them constantly track progress, identify any new needs, and really optimize those levels. The goal is to get your cells, especially those really delicate ones in the macula, working at their absolute best. It's that detailed personal data that sets it apart from, a one-size-fits-all vitamin recommendation.
That personalized, data-driven thing seems key. And here's what really surprised me. It's not just about the eyes, is it? The sources talk about this ripple effect health improvements across the whole body. How does fixing eye cells help your kidneys or joints?
Yeah, it's a fair question. If we're making eye cells healthier, what else benefits? Turns out, quite a lot. Because they're targeting fundamental cellular health, tackling things like oxidative stress and inflammation. Those improvements don't just stay in the eye. Better cell health can mean, for example, improved kidney function showing up in lab results. Less systemic inflammation, well, that can ease things like joint pain. When hormones are balanced and cells have more energy, that can lead to better mood, better sleep. Even things like skin and hair health, which often reflect overall vitality, can get better. And gut health, too, which is so connected to inflammation and how you absorb nutrients. It's this whole anti-aging, functional, or integrative medicine view, helping the body fix itself by getting to the root causes that show up everywhere, not just the eyes.
So it sounds like they're suggesting that traditional ophthalmology, while obviously trying to help, might be missing a big piece of the picture by not looking at this broader, functional approach. They seem pretty direct about that.
They are quite direct. Dr. Rozakis even shares that for years, as an ophthalmologist himself, he felt he was kind of tricked into thinking just recommending simple vitamins and leafy greens was enough for macular degeneration. They argue the standard AREDS formula, that specific vitamin mix and similar simple recommendations are just, well, inadequate, a one-size-fits-all solution that doesn't fit everyone. They point out the original AREDS study was almost designed to disprove vitamins worked, but then accidentally found a small benefit. And traditional eye care hasn't really moved much beyond that basic, incomplete idea.
So the argument is, by not digging into individual biochemistry, the traditional approach isn't really addressing the actual underlying problems.
That's pretty much it. They really emphasize that everyone's different. Different risks, different deficiencies. A truly comprehensive approach needs to find those specific fixable factors through personalized testing, not just hand out the same vitamin bottle to everyone. They point out, you generally can't have a deep conversation about hormones or methylation, which is crucial for DNA repair and cell cleanup, or complex nutrition science with a classically trained eye doctor. It's just not part of the usual toolkit. And this gap, they believe, has contributed to this epidemic of vision loss because the root cellular problems aren't being properly tackled.
Okay, that leads us to their study on dry macular degeneration. That's the form affecting millions, the one that often feels so relentless. Their results sound pretty significant.
They really are. Applying their functional medicine approach specifically to dry AMD, they found they could stabilize vision, stop it from getting worse, and even improve it in 48% of patients.
Wow.
Nearly half. That's a remarkable number for something so often seen as progressive and untreatable. It just hammers home that point about early intervention giving you the best shot, especially with dry AMD. The longer you wait, the harder it gets.
And beyond just stabilizing the dry form, they also talk about stopping it from turning into the wet form, the more severe kind. How do they approach that?
Right. They focus on a substance called VEGF, vascular endothelial growth factor. You can think of it as the bad actor molecule. It basically signals the body to grow these abnormal, leaky blood vessels in the eye. That's what causes wet macular degeneration, the bleeding, the fluid, the rapid vision loss, the kind that often needs those repeated eye injections. Their personalized program is designed specifically to help reduce the amount of VEGF in the eye. By doing that, they lower the chances of dry AMD progressing to wet AMD. And preventing that switch, that's a huge win, considering how intensive the treatments for wet AMD are.
So it's not saying the injections are bad, they help a lot of people.
No, not at all.
But maybe their program can make them less frequent, or ideally not needed as much.
Yeah.
Exactly. They're very clear. Anti-VEGF injections are often necessary and beneficial for wet AMD, but their program can complement them. By addressing the root causes of the inflammation, the oxidative stress, the idea is to make the macula itself healthier, more resilient. This could potentially mean fewer injections over time. Injections alone, they argue, are just managing the symptom, the VEGF buildup. They don't fix the underlying reasons why the VEGF is building up. Plus, injections aren't without risks or discomfort over the long haul. Their focus is treating the root cause driving that VEGF production, helping the eye resist it, helping it heal at a cellular level. Something injections alone just can't do.
They really drive home that message. Time is critical. The analogy they use is powerful. A house on fire. You wouldn't just watch a small fire hoping it goes out, would you?
You wouldn't. And your vision, for most people, it's the sense they treasure most. The longer you wait to address these underlying causes of macular degeneration, the more damage becomes irreversible. Acting early is always, always better. Like putting out that small fire before it takes over the whole house. They really urge people, if you know you have the disease, act quickly. Avoid that profound impact vision loss has on everything: driving, reading, hobbies, just quality of life.
What about the long run? Are these improvements lasting?
That's another really compelling part. The durability seems quite good. They've seen that the longer people stick with their personalized plan, the better the long-term results. They share stories of patients, even after years on the program, being told by their retina specialists, you know what, your eyes look so stable, so healthy, I don't need to see you anymore. Can you imagine the relief for someone told their condition was just going to get worse? And this includes managing wet AMD. They report a 60% improvement in outcomes there, which often means more stable vision and, yes, fewer injections.
So beyond AMD, how widely does this cellular health approach apply? Does it help with other eye issues?
It seems to have pretty broad applications, yeah. Take cataract surgery, for instance. Sometimes that surgery can stress the eye and worsen existing macular degeneration. But they found patients already on their program before the surgery don't seem to experience that worsening. That's huge for someone with AMD needing cataracts out.
Okay, that's important.
And then there's diabetes. We know diabetes can make AMD worse. Their program helps by improving overall cellular health and metabolic function, so it offers benefits for both conditions. Also, geographic atrophy, or GA, that's where parts of the retina literally waste away. They've found their program helps slow that progression. This might mean fewer people needing those new, very expensive eye injections specifically approved for GA. They're not against the shots, but they suggest trying our fundamental approach first, see if you really need them.
And it goes even further.
Apparently so. They mention it can also help slow things down and stabilize vision in other inherited retinal problems, like retinitis pigmentosa. It really highlights how focusing on basic cellular health impacts a whole range of eye conditions, not just the common dry AMD.
It really speaks to the unique team behind this, doesn't it?
Yeah.
Understanding who they are seems key.
Absolutely. You've got Dr. Rozakis, the ophthalmologist, with decades steeped in functional medicine, bringing that clinical eye care background plus the functional perspective. And Dr. Bakke, the Ph.D. biochemist with a master's in nutrition, who spent over 10 years intensely focused just on the macula's biochemistry. Their collaboration spanning 2 decades is really what makes their approach so different, so specific. And it's interesting, like you said, they didn't start out aiming to fix eyes this way. They were working on general health using functional medicine. And then discovered, wow, this has profound effects on the eye, too. It wasn't a direct path, more like following the positive results. That's fascinating. Exactly. And that journey helps explain why their approach is so different from other, maybe more superficial, complementary therapies people hear about.
Like what?
Well, they contrast their root cause method with things like red light therapy. They aren't completely dismissing it, but they argue it's often very expensive, the documented vision benefits are minimal, and crucially, it doesn't fix the underlying deficiencies. It doesn't address the reason the degeneration started. As they joke, you can't have a red light deficiency. Their whole focus is always asking why. Why is this happening at a cellular level, rather than just trying to patch over the effects?
This whole deep dive, it really makes you rethink how connected everything in the body is, and maybe how much potential there is for truly personalized care, even in areas we used to think were just inevitable decline. Dr. Rozakis and Dr. Bakke's work, especially with dry AMD, it really shows that acting early, taking a personalized approach focused on root causes, you can make a huge difference. Stabilizing vision, even improving it, plus getting those broader health benefits.
It really encourages all of us, I think, to see health as understanding and optimizing how our own bodies work. Just knowing there are real causes for things often brushed off as just aging, that's powerful. That's the first step to taking action for your own long-term health. And it does make you wonder, doesn't it, if this cellular level root cause approach can work for something as complex as the eye. What other conditions we see as inevitable might benefit from a similar rethink? It opens up some really interesting possibilities for the future of healthcare.